A concern that you might have about a breast lift is the concern about where scars might be. And I know that that's something that's difficult for some women to be able to make a decision to have scars on their breast. But I think by doing that, it allows us to be able to significantly improve your breast shape. Now, when I do a breast lift, where those scars end up is largely dependent on how much extra skin there is. It's also dependent on what size we end up at the end of the procedure. So for a lot of people, if they're coming in and are wanting to have an augmentation and a breast lift done at the same time, which is a very common procedure to do together, then we really need to make a determination about how much skin needs to be taken out once that breast implant is in, so that we can be able to get the best shape for you. Scars that are very common are, most people need a scar that goes all the way around the nipple. A scar from the nipple to the fold is also present most of the time. And then sometimes we need a scar that's in the breast fold. Now, most of the time that scar is only on the outside half of the fold, and I really try hard to minimize the need for a scar on the inside half of the breast fold, because that area is commonly socially visible in a bathing suit or maybe in some dresses. But we'll only make a scar on the inside half of the fold of the breast if it's just absolutely necessary to get the best possible breast shape for you. When I get to surgery, what I do is I create a space where we're going to put in a breast implant. Once I create that space through a real small incision, then I go ahead and put in a sizer, which is like a temporary breast implant that I fill up to the size that you really want to be. And then I start to put stitches in the skin, just to kind of tack the skin like a tailor might custom fit clothing for you. And then once I'm able to determine what skin absolutely needs to be removed to get the best possible breast shape for you, then I go ahead and take out those stitches, I take out the skin that needs to be removed, and then that lets us be able to use only the scar that's necessary to give you the best breast shape.